welcome to TED EDU. I am your host, Layla Lohmann, brought to you by the TED Community Organization. I'd like to welcome you guys today with two of my friends, Julie and Andrea. Julie, I met in the Aspect program I'm a graduate of, and Andrea I met through the Thyroid Eye community. The TED EDU webinar platform features highly relevant information and timely topics related to thyroid eye disease. Each webinar is packed with practical information to help you navigate through your journey of sometimes a confusing and overwhelming and lonely TED journey. We encourage you to learn about thyroid eye disease so you can best navigate the TED journey, but we never want you to feel alone. With us today, like I mentioned, there's Julie from Prevent Blindness and Andrea, a TED patient who advocates for others, and she'll tell you about her own journey. I'd like everyone to know a little bit about you both. Julie, could you tell us a little bit about yourself and your interests and how you got into patient advocacy?
Sure. Thanks so much, Layla, for hosting this. My name is Julie Grutzmacher. I'm the Director of Patient Advocacy and Population Health Initiatives at Prevent Blindness. We've been around for a long time. We were founded in 1908, and we work on education, advocacy, and inpatient empowerment. And so my love for patient advocacy really has spanned a multitude of venues. I started my career in the hospital, moving to community health centers, to academia, and now to nonprofit. And the through line has been patient advocacy. I think that there's a great need for it in today's healthcare system in the US. And so I'm just really passionate about providing the needed resources and education to help patients feel empowered to do the best they can with with the condition they have.
Well, thank you so much. And thank you so much for your hard work, Julie. Andrea, could you tell me a little bit about yourself?
Yes, thank you so much, Layla and Julie. It's a pleasure to be creating this wonderful resource for patients. My name is Andrea Perryman. I'm a thyroid eye disease patient. My world was turned completely upside down back in 2016 when I was diagnosed with this disease. And back then, there really weren't many treatment options available back then. But since then, thankfully, there are new therapies available on the market. And I've been able to get the wonderful treatment that I so desperately needed. And now I've gotten my life back. And since then, I've been advocating so that I can help other patients throughout their journey on this journey with this diagnosis.
Well, thank you. Julie, what is advocacy and why is it so important?
So advocacy really is about giving voice to something or taking action. So this can be, and there's an element of wanting to influence decision or decision makers. So this can really be in relation to advancing certain causes. It can be certain experiences that you want to advance, or maybe recommendations or policies. There are many different types of advocacy. So many think, well, it's just legislative or federal. That's not the case. There can be, anything from community organizing on a topic, or education. So feeling informed as a patient about your eye condition and going into the doctor and feeling empowered to ask all your questions, express your values and concerns, all of that. So really being able to take action and give voice to a cause in some way. It's also part of, certainly if you are going the legislative route of advocacy, it's part of the First Amendment in the U.S. Constitution. It's also a part of the democratic process. So it's really important, and it's our right to advocate.
I think you're right. And I think it's really nice for people to understand that advocacy, it can just be standing up for yourself or being informed so that when someone tells you maybe something that you don't want to hear, that you can ask them why and not have fear of pushback or rejection, but really just advocating for yourself. So I appreciate that. Speaking more about personal advocacy, Andrea, for someone living with thyroid eye disease, what role can advocacy organizations like Prevent Blindness play in that journey? And have you had any organizations help you in your advocacy?
Yeah, I think that's a wonderful question. I think that advocacy organizations like Prevent Blindness play a crucial role in the journey of many individuals that live with thyroid eye disease and other diseases in general. But these organizations, they typically offer support, resources, advocacy on behalf of patients. I think specifically they can educate and raise awareness, which increases understanding among the public and healthcare professionals. In addition, they provide information and resources. Often, these groups they'll offer valuable information about disease states, including information about your symptoms, treatment options, and even lifestyle tips. They also offer support networks, which is incredibly important. They can create support networks for patients that connect them with others who share these similar experiences and challenges. They also advocate for research and policy. So oftentimes they sometimes engage in advocacy efforts that raise awareness about a specific disease like thyroid eye disease, or they may advocate for improved access to these treatments through various policy changes. And in addition, they may also advocate for research funding to develop these new treatment options as well too. And I would say lastly, some of them offer patient assistance, which helps provide financial assistance or access to treatment programs for individuals who have difficulty affording their treatments for thyroid eye disease. So they've
Yeah.
played a really great and monumental role in my treatment journey. One organization that's really helped me along the way was Infusion Access Foundation. They really helped connect me with so many other people and even other patients from other disease states too. And it was wonderful learning about their experience as well. Just kind of helps you feel a lot less alone.
Yeah, no, that's true. And that's why, we have brought in the tedcommunity.org as a
Mhm.
specific advocacy for our thyroid eye
Yeah.
condition. And really, Christine, our founder, and myself was a part of one of the programs that Julie will be speaking about in a second. But that advocacy is important, and I really appreciate you taking that time and helping people and giving more information on different advocate organizations like that. Julie, what type of resources does Prevent Blindness provide to assist patients in their eye care journeys from possibly their diagnosis to their full management of the condition?
So Prevent Blindness has a number of different resources on our website. So we, as I mentioned, our strategic plan really falls into three buckets. So it's the educating the public. We have patient empowerment initiatives, and then advocacy is the final component. So we have lots of fact sheets on various topics. In addition to that, we also have a Focus on Eye Health expert series, where the most recent one on thyroid eye disease was done. It was an interview by our president and CEO, Jeff Todd. He interviewed a neuro-ophthalmologist, and those interviews are all stored on our YouTube channel. We also have a variety of really great resources on our Living Well with Low Vision website, which is geared towards patients, caregivers, and healthcare providers. And the information is really nicely organized on that site, including some opportunities for clinical trials. So that's all listed there. And then finally, around the patient empowerment component, we have the Aspect Patient Engagement Program, which was started 3 years ago and which aims to train and equip individuals who have a vision impairment or some vision loss and blindness due to a variety of conditions, including thyroid eye disease, as well as their allies. So this could be eye doctors, psychologists, occupational therapists, allied health professionals coming together to learn advocacy-related skills. And really foundational to that curricula is storytelling. So really training folks to be able to tell their story and to tell it well, to use it as an advocacy tool, because stories really do stick with us. It's a really powerful tool to affect change, to change minds, change policies. And so that program has offered a platform for individuals to connect and to feel less alone and to share experiences about gaps in healthcare delivery, challenges that they have accessing certain treatments, just coming to terms with diagnoses, et cetera. So it's a program that's we've now trained 168 individuals through it across more than 30 states. So it's a virtual program that we have.
No, it's an incredible program, and as you know, Christine and I are both graduates of that program. And honestly, the networking aspect and the support aspect, like Andrea mentioned and that you mentioned, it's just been eye-opening, pun intended. And it's been nice to be able to connect with people with similar conditions, but you just get different ideas of what advocacy can look like for you. And I think the ally component is actually really nice. As a healthcare provider myself, I think an informed patient is a smart patient and they can make informed decisions. And if you don't understand it, or you maybe don't really advocate to understand the why, you can't really make an informed decision for yourself. And the allies include your caregivers. And so the fact that your organization helps support all facets through the condition, from the diagnosis to management to allies to the caregivers to the other healthcare providers, is an incredible feat. So thank you for doing that. And the program is great. So if anyone wants to know about it, Julie can drop her contact information and we'll put it on a link underneath the webinar. Andrea, what are some key lessons that you've learned how to be effective advocate for your needs and treatment options during your thyroid eye disease journey?
Yeah, so I think that we covered one of them when you guys had mentioned educating yourself and staying informed. I think effective advocacy for TED patients really means that you should learn as much as possible about your condition, treatment options, and available resources to make those informed decisions. I really think that knowledge is key to effective advocacy, especially when you have a chronic illness. I think in addition that it's important that patients build a strong support network and they join advocacy groups. I think patients should consider joining an advocacy group like Prevent Blindness, or thyroid eye disease specific organizations like TED Community Organization. These organizations really make it easy for volunteers and participants to engage in awareness and even fundraising events. I think that by building a robust network, patients can connect more easily with even healthcare providers, support groups, and other advocacy organizations, and will help them access guidance and support. I think that they can also engage in open communication, and it's important that patients know they can seek second opinions. It's important for patients to establish clear and open communication from the very beginning of their diagnosis throughout their entire treatment journey with their healthcare team, so that they can discuss their needs and concerns and treatment goals. I think in addition, patients should also ask tons of questions about the various treatment options, the potential risks, or even alternatives. And they shouldn't hesitate to seek second opinions from different specialists when necessary to ensure that they receive the most appropriate and best possible care. And I think a very important thing for patients to understand for effective advocacy is sharing your story is incredibly powerful. I think that it's important to share your story and even participate in awareness campaigns that will help not only yourself, but other patients as well. So I think sharing your personal experience as a patient or caregiver or healthcare provider, it really acts as a powerful tool for raising awareness about your condition. When you're living with this rare condition, it can be very isolating, a very lonely experience. So by sharing your experience, you help others cope with their condition, also make them feel less alone. Advocating also means that you advocate for policy changes when necessary as well. It's important that you can know that you have the ability to contact your local representatives and advocate for policies that support access to thyroid eye disease treatments that will help improve your care, improve patient care in general. And that's basically, kind of what I would what I've done in my treatment journey, and those are some of the things that have helped me along the way.
No, that's super powerful and very important. I know I struggled with getting a second round of medication that I needed, and I had to email my congresspeople, and they called me back, but they were really like, in order for us to affect change, you need to be joining up with organizations that have bigger voices than one. And so one voice is very powerful, but many voices together, going with the similar concerns and challenges, it just is even more powerful. So like you mentioned before, like saying your story is going to help you connect with others and just make you feel less lonely. But it was more of when you do different things in the industry, if you can say your story and get into these policy changes, which we'll talk to Julie about, of just how to getting into legislative advocacy, it really can impact how much money goes towards these organizations to then affect change. So one person may not be able to, have that affect change, but that one story can affect many people to go make that change happen. So I appreciate that perspective. Julie, if somebody was interested in legislative advocacy, what strategies would you recommend for possibly a beginner, someone who may be afraid to speak their truth?
Yes, it's such a great question. And, I would recommend, so because I'm at Prevent Blindness, I can recommend getting involved with Prevent Blindness. But of course, there are many other patient advocacy organizations doing great work as well. But I would say a really nice way to get involved, in addition to contacting your legislator and your local reps, as are previously mentioned, I would say if you wanted to join our annual advocacy day, that is a really nice way to get your feet wet in legislative advocacy, to get familiar with how many other organizations do it, and certainly what our approach is. And so you learn about the importance of being on teams. You practice certain talking points so everybody knows what they're going to cover. You are informed ahead of time what your asks are. And then, a lot of the patient advocacy organizations have lobbying firms who help to schedule meetings with members of Congress. So that makes it easier to just, show up and be prepared with your talking points, and what your role on the team is. And you can share a bit. You can partake in the asking, of the advocating, and you can also share your story. And it's a nice exercise in relating your story to the talking points. And again, it's just one way of doing it. Certainly a nice introduction. What our ask is every year is for additional funding to go to the CDC for the vision and eye health program that they have, and the glaucoma program. So it's more broad in scope and not, specific only to thyroid eye disease. But I would still very much encourage those who have thyroid eye disease to get involved in that, because as mentioned before, we are definitely stronger together. And along those lines, we also have something that's called advocacy alerts. So for the rest of the year, because we have so many different partner organizations that we work alongside of, there are many different initiatives that others want to advance. And so we will often sign on to a various letter that is being advanced on perhaps a bill that's been introduced. And and we, assert an opinion about it, and others maybe sign on to that letter. So you have a chance to get involved in those initiatives. And it's really nicely organized on our website. So you can just simply sign up for advocacy alerts at advocacy.preventblindness.org. And then you can, receive the opportunity. And oftentimes it's just a template that comes to your email. And so it may be an email that you can send and kind of, make it individual, according to your need, but you can send it to members of Congress. So it's nice to get some experience that way, where we're, as a patient advocacy organization, providing the template, letting you know who to contact on what topic, and you have that opportunity to go ahead and raise your voice on the topic. So, as it aligns with your interests.
It actually makes advocacy really easy because, we don't know how to word things the way we want to. So it makes it where you get it, we can add in our own personal touch and just send it. So it is very amazing that you guys provide those templates.
Yeah, exactly. And so those are the two things that I would mention that I think are just a really great way to get started, to get exposed to that type of advocacy. And then, it's a jumping off point to learn about other organizations and to learn what they advocate for every year. Because there are lots of people out there who go to the Hill every year for their annual advocacy day. So it's a nice introduction.
No, it is. I actually participated in my first Eyes on Capitol Hill last year. And you guys are very organized, which makes everything so much easier for the fear of the unknown for those of us who haven't participated before. And I also didn't want to just because I was scared and I was like, I don't want to do this. But then I thought to myself, how do I get that change and how do I not wait a year and a half for a second round of treatment that I need immediately? And to Andrea's point, like the necessary access is so hard for some of us, and we have me and Andrea are talking, and so is Christine, and so we want to advocate for those who are not comfortable speaking up. So Eyes on Capitol Hill was it's very insightful, very organized, and it really does make advocating for yourself easier. And if you participate in programs like Aspect, you have access to Julie, which is networking, to help with elevator pitches. And, I sent her some information of how do I make this 2 minutes or less to be as effective as possible. So these legislators and senators' aides really hear your voice, and you want to be that memorable person, and your story is memorable because you can relate it because somebody in their life does have low vision and somebody in their life does have one of these conditions. And so it was very powerful. So I appreciate that. Thanks, Julie. Andrea, I know you had specific resources you already mentioned earlier, but is there anybody in particular you found most helpful in your journey for advocacy in thyroid eye disease? Other than yourself, Andrea?
Right. And then also too, I have to try this Aspect program. I hear so many great things about it. It sounds like an amazing thing. I'm interested in trying it myself, and joining. But I think, really, Layla, the good news is that there's so many more resources that exist today for thyroid eye disease than previously, especially when I was diagnosed. It's almost like it was non-existent on the internet. There really wasn't much out there at all for this disease. So it made it even more hard to deal with. But now there's so much more. I think that some of the organizations and resources that I've found helpful along my journey include Prevent Blindness. Their website has been incredible in providing resources for me and educational resources as well. But they provide resources for a variety of eye conditions, not just thyroid eye disease. And then of course we have the TED Community Organization. It's a newer nonprofit organization, but it's focused solely on thyroid eye disease, which is fantastic. So many educational support and resources are available on the website. And really it's a community that can connect you with others who live with thyroid eye disease. And that's been really special for me. I've connected already with a lot of patients in the community, and it's been really great. Because as you guys know, I mean, this, just because you've gotten treatment, you know, you're still dealing with this chronic illness, you know, and so you need to connect with other people that are living the same on the same journey as you know. And then another one I found always helpful was the American Thyroid Association. They provide tons of information for thyroid related conditions, including thyroid eye disease, which is great. We know that the majority of thyroid eye disease patients typically have other underlying conditions as well, like Graves' disease. And so the American Thyroid Eye Disease, the American Thyroid Association also has resources around Graves' disease as well. And then, of course, last but not least, I've also found the Graves' Disease and Thyroid Foundation very helpful as well.
Yeah.
They provide a lot of educational materials for people with Graves' disease. Also, again, a lot of people with Graves' disease usually get thyroid eye disease. And so that's also been a great resource as well. And then I would suggest lastly, that patients think outside the box. You don't necessarily have to just go to an advocacy organization specifically for thyroid eye disease. There's other patient advocacy groups that cover a broad spectrum of different diseases. They've helped me connect with other patients as well. And I learned from these other patients. You know, it's been very enlightening and eye-opening for me to connect with patients who live with other chronic illnesses. And they've learned so much from me, and I've learned so much from them. And it's really just been an enlightening experience to share the similar experience with other patients across the board in the rare disease community.
Thank you. I mean, you're sharing your story is very important. And that brings me a little bit back to Julie. What do you think is the most value about storytelling to raise awareness, specifically about thyroid eye disease, but just in general? Why is storytelling so valuable?
Storytelling, it's a way to be super impactful because it sticks with people. It's hard to even put words to it, honestly, because I feel and I know in my heart how powerful storytelling is. You know, you think about if a teacher, for example, were to give you list off stats, for instance, what's the prevalence of people who have thyroid eye disease across the nation? What are the symptoms? What are the risk factors? And you may remember a good amount of that information, but when somebody tells you a story about what they've journeyed through, how maybe they had symptoms or did not have symptoms, how not knowing the risk factors maybe, delayed or exacerbated symptoms, how not knowing anyone in their community made them feel so isolated, how, difficult it was to seek treatment and how they were lucky to have insurance, but even with insurance. And it's a world of difference between when somebody shares what it was like for them. I think it commits it to memory in ways that just straight up facts or statistics won't do. It falls
Yeah.
short. It pulls on the heartstrings. It like triggers, I think, better memory. And it
Yeah.
definitely, we know there's been studies on the brain, when somebody's telling a story and when a listener is following along, there's actually this connection and sort of their brain waves are in sync. They've done MRI studies on this. So it's truly powerful. And the more and more you can become familiar with your story, you can practice telling your story. There's a therapeutic element in that also. And then, when you learn how to adapt it for your audience, because some people are going to resonate with certain things and others not. And,
Yeah.
as you can adapt it to really have it land with them, to impact change, changing minds, changing policies. It's a power that is unparalleled in my
Yeah.
experience.
Yeah, there's a quote that I really like that it says, tell me and I forget, teach me and I may remember, but involve me and I will learn. And I feel like storytelling is what that does. It involves you in that life, and it really does capture like you said, it's like a powerful emotion because you see someone living it and you can see the emotion in their story. So that's really true. Thank you so much. Well, Andrea, it seems like you're in a very good place with TED right now. I feel like you're very blessed in that situation. What motivated you to turn back and help those who may struggle with feeling alone with this diagnosis?
Yeah, so I really think that what gets me out of bed in the morning is the desire to inspire others to live their best lives. 7 years ago, I felt completely hopeless living with this condition, but I've been fortunate and I've been able to take back control of my life thanks to the advent of these new therapies now available for this disease. So I know what it's like to feel hopeless. I know what it feels like to feel like you just can't get out of bed in the morning and you don't want to do anything. So I think now that I'm in this great place, that now I'm on a mission to use my story to offer hope and support to others who are currently battling with this awful and terrible condition. Although it's a difficult disease to deal with, the great news is that there's now it's possible to now get your life back with these new therapies, and I really just want people to know that.
No, I think that's right. I think everyone has individual care and individual needs, but I think that not understanding what's available to you is part of the issue. And I think that the awareness and what TEDcommunity.org is trying to do and prevent blindness and different advocacy groups, including patient advocacy, is trying to share that you need to know what's available out there because, if you don't know, you can't talk to it with your provider. And if your provider doesn't know about it, then they can't talk to it about for you. And so with these new technologies that, advocating for um, funding for understanding these, getting those healthcare providers and medicines available to us, it's very hard. And so it's places like the Prevent Blindness and all the advocacy that we've talked about where you can find out what's out there, what's available to you. And we want to give you the tools to make the change. And so on that final note, do either of you have any last advice for anyone looking towards advocacy, patient advocacy, self advocacy that you would like to leave our listeners? Julie?
I would just say stay open and really, learn as much as you can, share your story as much as you can. And I think there will be, great benefit in both to the self and then to your community with, through your efforts. So absolutely, get out there and share your voice.
Thank you so much. Andrea, do you have any last thoughts?
Yeah, I would say that, continuing to share your voice and spread the word is the most powerful thing that you can do. It's incredibly empowering for yourself as well. Like I said, you have the opportunity now to take your life back and really get out there and like I said, spread awareness and get help for other people. And in turn, like I said, you empower your own life as well. And I think that you'll really enjoy doing that. So.
Well, I appreciate you both taking the time today to spend with me to discuss advocacy and your patient journey. I want to thank everyone for listening. If you're struggling with this condition, or if you're struggling on how to talk to your caregivers or anyone in your life or need any advice, please visit us at TEDcommunity.org and learn about what we can do for you. I want to thank you guys, and I look forward to seeing you on our next webinar. Thanks, Julie. Thank you, Andrea. Bye, everybody.
Thank you. Bye-bye.